Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Welcome everyone back to the Healing Grove podcast. I am really excited this week to have this conversation with Anni Powell. Anni Powell is a registered nurse and a certified craniosacral therapist who has practiced as an RN since 2011. She has a background in cardiac intensive care, in the progressive step-down unit, in family medicine, which is near and dear to my heart, and in hospice care, where she still currently serves as a hospice nurse. Anni began studying craniosacral in 2020, and she completed the craniosacral therapy certification pathway in 2023. But she continues to study with the Institute and with personal mentors in that space to refine the art of craniosacral therapy and SomatoEmotional Release, also as an assistant in craniosacral classes. So we are really going to take a deep dive into craniosacral today, learn what it is, what it can do, what kind of results you see using this important work. And to start off, though, I always like to hear from my guests a little bit about the path that brought you to this work.
Yeah, so could take you down a rabbit hole, but I'll kind of give you the shorter version. So many years ago, I was fresh out of nursing school and started working in the hospital and started to get sick. And I think it was looking back on it, all the stress, the not knowing how to actually take care of myself, working the night shift, and going to these doctors and them not having answers for me. And it was any number of things. It was period problems, it was migraines, I had a scare where I lost my vision at work, GI issues, terrible skin issues, just all sorts of stuff, and didn't really know what to do. So over time, the right people just started showing up in my life, and just teaching me about like these little things that you could do. And started learning about homeopathy from a very close family friend and took classes with her, and moved from being steeped in the medical model of, oh, I need a pill for this or take ibuprofen for the migraine, to what's really going on that's making these things show up in my body and how can I really fix them. So homeopathy was like a huge starter with that, like just learning about what that's like. Started going to chiropractor for like shoulder pain and just somatic issues that were obviously stress related looking back on it. Yeah, just delving down into that rabbit hole of like, what can I do? Yoga, breathing, a lot of things that I learned that didn't really stick. And it was at my chiropractor that I've been seeing for like the last 8 years on his shelf. He had a book about SomatoEmotional Release, which was all about like craniosacral therapy. It was the Upledger paradigm. And I just plucked it off. I'm like, what is this? Because as I'd done my work with him, like these strange emotional things would come up and out of my body. And I knew that they were directly related to what was going on inside of me. And found that book, poured through it. My husband, I found other books about this, and he said, oh, there's someone in our church that's been doing this forever, like 30 plus years. Maybe you should talk to her about it. And met with her over tea. And she said, oh, there's a class in Philadelphia next month. I took the liberty of looking that up for you. And she gave me a little mini session there. And I was just off from that point. I was like, this is something I need to do. Grapples with it back and forth. Like, is this really what I need to be doing? Am I doing it correctly? A lot of imposter syndrome. but everything keeps pulling me back into this modality, and just the benefit that I've received from it, and also that I see in other people, is just, it always amazes me. So here I am, and I'm really happy to be here with you today and to be a voice for this thing that not a lot of people know about. So,
Yeah, for sure. So tell us a little bit about the background of craniosacral therapy and explain what it is.
so craniosacral therapy, Dr. John Upledger, he was an osteopath, and he started developing craniosacral protocol like back in the 1970s, and he's um, operating out of the osteopathic paradigm. So Dr. Still, who was a Civil War surgeon, um, I think he was the first person to discover what he called the primary respiratory mechanism, which now we call the craniosacral rhythm in Dr. John's language. And from there, Dr. Sutherland, built upon the work of Dr. Still, and he developed cranial osteopathy. So it's kind of like this trickle down effect, all starting with cranial osteopathy with Dr. Sutherland. And Dr. John, I think it was during a surgery, he saw when the surgeon was asking him to hold whatever they are, the little clamp things open, hold them steady while he's doing neurosurgery. This motion that he couldn't, it kept moving. And he's like, hold it steady, hold it steady. And he's like, this thing just keeps moving. So he was actually seeing firsthand this physiologic movement of the craniosacral rhythm, like of that cerebral spinal fluid moving underneath the dura mater. And, those things that Dr. Sutherland and Dr. Still had initially found, he had proof of it right under his hands. So was that answering your question about where did it come from? Like, how did this
Yeah,
begin?
yeah, for sure.
Okay.
Tell us, but explain for someone who hasn't studied this, how would you describe the purpose of this primary respiratory mechanism or the craniosacral rhythm? Like what exactly is happening and why does the body need that or do that?
Yes. So craniosacral rhythm, we feel that as the body is circulating and filling and emptying cerebrospinal fluid. So that's the fluid that bathes the central nervous system. It surrounds the brain and the spinal cord. It exists. So in the brain, we have what we call the meninges, and there's different layers of that. So if some people know what an epidural is, that is the space before you get to the dura mater. Then we have the dura mater, the arachnoid mater, which is fused directly underneath of that. And then in this space, the subarachnoid space, and directly next to the brain with the final layer of the membranes is the pia mater. That's where the cerebral spinal fluid exists. And they recently actually found that it doesn't just circulate all willy-nilly through there and just, seep through the brain tissue. I think it was like studies back in like the late 2000s, like 2010, 2012. They found that there's actually an extracellular matrix within the brain. They're calling them glial cells. So it's like the structure of those cells are what protect the neurons. So you have glial cells, nervous cell, and neurons. And the CSF is going through this network of glial cells, and it's going in to transport nutrients, remove wastes, cushion the brain, has a lot of jobs there, and we need it. So we know that it's this thing. Dr. Upledger also developed what he calls his pressure stat model, which explains how that filling and emptying occurs and how we can feel that at any point on the body as a therapist. So the pressure stat model, in the cranium, we have, that circulating CSF. There are venous sinuses that reabsorb the CSF. And then there's also things that we call choroid plexus, which are in the ventricles of the brain. So we have, I think, 4 ventricles of the brain, and those are primarily located in the lateral ventricles. Choroid plexus's job is to be the producer of that CSF fluid. And these arachnoid villi inside the venous sinuses are, their job is to be this constant, baseline emptying of CSF. So the mechanism works. So in your sagittal suture here, he hypothesizes that, as they're not fused, which has been controversial in the osteopathic world, that there's collagen and nervous tissue in there and stretch receptors. So as your choreoplexes are saying, fill, 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 this suture is coming apart. And when it gets to the point where it's like, I don't want to fill anymore, starts to empty, and it allows that baseline emptying to occur through the arachnoid villi. When those sutures approximate again, then it turns on. So that's the mechanism by which it's saying, turn off production, turn on production. And I believe the reason why that you can feel that throughout the body is not necessarily that, it's filling and your whole system is, just rotating because your body's filling up with this fluid. I believe it's actually pressing upon the primary motor cortex up there. So it is creating this external flexion when it's filling and this internal rotation of extension when it's emptying. So that's what you're feeling on the body as a therapist. And it's telling you a lot of information about what's going on in your craniosacral system, where restrictions might be in the body. Because in an ideal world, you would be just flexing and extending, wouldn't have any kind of impedance anywhere. But we all have injuries, traumas, illnesses, all sorts of stuff that we collect over the years. And that helps to get the therapist honed in on an area that may not be flexing or extending as ideally as it should. And that's how they know what to treat in order to get everything moving more smoothly.
And I'd like to get into what a treatment looks like in a minute, but first I have to just admit my own trouble with this model. I'm a big experiential person, and I have tried with the guidance of many people who have been Upledger trained to feel these rhythms, to understand what they're feeling on the body. I have zero sensitivity to that. And I know a lot of people in the beginning of their training also feel like, I can't feel these rhythms. I can't feel this. I don't know. And so from my experience, it's hard to say, oh my gosh, yeah, this totally exists. What I will say is I've been a patient under the care of someone doing craniosacral many times, and I always feel something, some result. We can talk about that more later when we talk about like what do people come to craniosacral for. But can you speak to that difficulty of feeling it and kind of experientially knowing that you're actually doing something as a practitioner?
Yes, absolutely. Like you and like many others, when I first started, I didn't feel anything. I was like, then that was part of the imposter syndrome. Like, what is this? But it all makes sense. And I think I'm feeling something, but I really don't know. So part of that is, we have a left brain and we have a right brain. And our left brain wants those answers. It wants logic. It wants why, which thankfully there is explanation for why, rather than just going in and saying, oh, this is what it is. And just, this is what it is. And a lot of people will be like, no, how could it? It's impossible. And then the right brain, we have a right brain for a reason. And I think a lot of us turn away from those intuitions, those sensitive things that we pick up on and just, it's nothing. So Dr. Upledger, when he, I think part of in the study guides for the classes are going in and taking those questions and just putting them to the side while you're doing this, and really tune in and be okay with like not knowing the answers, accepting what's coming into your hands, what's coming into your awareness. And also the importance of imagination, because the body and our psyche and our dreams, all of that's coming from our non-conscious, and that's how it can communicate with us. It's pre-verbal, it's pre-logical. So you kind of have to work with that a little bit, and also trust. And for me, it took, practicing on myself. I think this is what I'm feeling. I think this is right. And eventually I had to go to a colleague that I was seeing from my own therapy and say, okay, I don't know if I'm doing this right. I don't know if I'm feeling anything at all. And she's like, okay, put your hands on your legs and tell me what you're feeling. And she put her hands over top of mine and she said, yes, that's absolutely what you're feeling. And it was just like a light bulb went off in my brain that I'm like, oh, I'm not making these things up. These things that I'm feeling are real. And it's almost kind of like you just tune into that. It's like a fulcrum. Your proprioceptors just kind of get used to what's going on there. And then you get better at it the more that you practice. So that's what I have to say about that.
That's so interesting. It's reminding me that when I was in medical school at Stanford, in the first year we had like a histology class, where we're looking at slide
Mhm.
after slide after slide of like monkey jaw and kidney and liver and spleen, and they would be like these intense descriptions about all the things you were supposed to see, and sometimes we just be looking at the slides and we're like, okay, use your histoimagination. Like
Yes.
just imagine that you're seeing what they say. And then slowly, almost like those sort of like dot pictures where suddenly everything comes to the foreground and you actually see that there's an image hidden behind all those dots. It just looks
Yep.
like chaos. Suddenly it would just come out. It was amazing.
Yep.
So when you say you would, I heard both things. I heard you'd feel it, but I also heard you would started to trust your awareness of what was just popping into your awareness. How much of what your assessment is when you're doing a treatment is what's sensory, like coming in through your hands, and how much of it is just other aspects of your intuition and awareness? That
I
question
say
came
it's,
from my left brain, obviously.
yeah. It's a lot of both, but because of the manual therapy, like this is a manual therapy, and I'm informed first through my hands. If something else comes into my awareness, I don't like to bring those things up unless the client is bringing something up, or if I say, more like a question of like, hey, what's going on under your hands? Because this experience is about what they're experiencing. So what I might feel coming in might not be the same thing as what they're experiencing. So I want to hear directly from them. And it's interesting because as that evolves, and if there is a dialogue that starts to develop with me and the client, you'll feel the tissues change like big time under your hands. And all these things are shifting around. It's like, oh, this is very significant. We're into something here. And that facilitates the whole process. It's very amazing. Like, let the body speak to your hands. That's the non-conscious communication to you. And then sometimes it shows up in conscious awareness, which, side note on craniosacral therapy, is it's not all about help my aches and pains go away, help these issues. Is that there's a lot about self-realization and insight that is just totally valuable to what you might need to heal. Or even if you don't need to heal, like don't fix it, just be aware of it, have acceptance, compassion for it, even curiosity about it. Yeah, it's very interesting.
I love that. And I'd love to hear your thought on why that happens in cranial, why that, and it happens with a lot of different body work, right? A lot of different touch-based therapies where the body starts to unravel old things and they want to come out. But how would you describe that for someone who's maybe having their first session on the table and they begin to cry, or they begin to have a memory of something from the past and they have strong emotions that are coming out? How do you normalize that for people?
Yeah. Um, well, first and foremost, my job is to remain like grounded and supportive and just non-judgmental and just to listen and hear what they like, what do you really need right now? And you can go there with them, ask them, so what are you feeling right now? What's coming up for you right now? Just to get a good picture of what's happening for them. Um, I don't like to go into the whys. I don't analyze anything. That's not my job. I'm just here to help sort of be a detective and help them to discover these things for themselves so that they can then own it and decide what to do about it. But I am here to facilitate and support that process. Um, Afterwards, or even, I mean, if during they have questions, I can certainly explain that sometimes tissues just hold on to stuff. When we go through traumas, any kind of trauma, physical, mental, emotional, like viruses, things that we're eating, stuff can get stuck in our bodies. We make hormones and just neuropeptides that can get lodged into our cells. Sometimes we process through those things, sometimes we hang on to them. And, if I were to go and, I'm really angry today and I go outside and I twist my ankle, the emotional state of the person during the time of injury might impact whether or not that injury sticks around or has an emotional tie to it, just because of what's in your body at that time. So it's like, I got all these anger things going on in here. I got neuropeptides for that, hormones that are circulating that got me on alert. My RAS is like, blah. And what happens with that? Like it might get stuck to a sticky area that's inflamed now. And there you have it. And if the body is like, I don't have time or energy, or it's not safe to deal with this right now, process it, it might hang out there for a long time. And it could be years that that thing is in there. And, later on, I'm like, oh, 10 years down the road, somebody's got, I'm on somebody's craniosacral table and they've got my ankle in their hands. And all of a sudden, I'm just so angry. I am fit to be tied. And I'm like, what was that? I might not know what that was. I might have it pass through my awareness that, oh, yeah, I twisted my ankle that day and I was so mad about that thing. And that's it. Or you might not know at all. It just might be a feeling in your body, a sensation as those like things come out of your tissues. Those neuropeptides are designed to make you feel that way. So you might feel it again. So that's kind of what I would have to say about that.
That's a really, really clear kind of an understandable mechanism or proposed mechanism for how that happens. Thank you.
Mm-hmm.
And I'm wondering, as I'm sort of considering just how deep these sessions can go, do people typically come sort of knowing they're going to have potentially some sort of deep catharsis and, transformation of old stuck wounds, or do they not expect that typically?
I think it depends who it is. Um, I think a lot of people don't expect it, but I also believe that the body and your psyche will give you what you need when you need it and when you're ready for it to come up and handle this and address it to kind of move forward. It's not like you're trying to fix anything, but you might be outgrowing that thing. And now it's like, you're outgrowing this. We don't need this anymore. You're carrying it around. Look at how much energy you're putting into this, I guess I'd call it a holding pattern or this stuck thing that all your body's doing is like being your friend, putting that there to protect you from that thing, whatever it is, whether it was an old injury or an emotional thing or anything. And it's like, oh, it's safe. Everything's going great in my life right now. It's like, okay, it's time. Let it go. You don't need it anymore. So I'd have to say, even for myself, I've been like, what the heck was that? Like, didn't know that was in there. And it's like, oh my gosh, the burden is lifted and this is good. And then sometimes you see other therapists who actively want to come in and do the work. Like there are people, usually they've been therapists that are like, I want to do this inner work. Because I do believe that doing the inner work, and one of my favorite instructors will tell you that doing your inner work and being more grounded and knowing who you are on a deeper level makes you a better therapist. And that's the most useful tool you can bring to the table.
I love it. I love it. So what do people typically come in with? Like, what are the common problems that someone seeking out a craniosacral therapist might be experiencing?
Yeah. I've had people come in, GI issues, musculoskeletal complaints, scoliosis, TMJ, definitely. Babies with tongue ties, trouble latching and painful breastfeeding. Um, yeah, any number of things. So it's I've treated my husband with Lyme. That's something I was like, oh my gosh, we got to get your CSF moving here because, he's brain fogs, migraines, definitely with migraines, and headaches are very helpful. Chronic stress, which can cause any number of these things going on, like high blood pressure, peptic ulcers, all sorts of stuff. So anything that you might have related to dysregulation of the autonomic nervous system or just stress overloads, where you want to shift out of that sympathetic response to kind of go into the rest and digest mode. is really helpful. Children with autism, PTSD, allergies. There's a big list.
And you see success with all of those things?
I have not personally seen all of those things, but the ones that I have seen, I did see that they had changed. And whether it was the first treatment or if they needed to kind of come to get those petals going a little bit, everybody's different. So,
Yeah.
yeah.
Yeah. So, talk to me a little bit about what someone can expect from like the just sort of the basics of a treatment. They come into your office, there's a table and there's you. What else would they expect and how does it usually go?
Yeah. So when I see a client, my time, I like to keep it very relaxed. I don't like to be a clock watcher. So I leave a lot of space. Normally it's an hour treatment, but I give myself 2 hours. So you come in, we can chat. You can tell me about what's going on in your body. First time clients, I have you fill out an intake form just for like a brief history of, what's going on so that I can have some awareness of what to be mindful of if something should come up, um, or areas of pain. I like to know those too, or if there's anything like really active going on with that person, and just listen to them. And when they're ready, have them get on the table and it's a comfortable table. I say wear layers of clothing because sometimes as you sink down into those different brainwave states, your body can cool off a little bit. So you're coming out of that, like, that beta state where you're awake and you're perhaps more the anxious side of beta state. And then you come down into the alpha state, which is just this relaxed sort of awareness. You're at peace. And the session just goes from there. Definitely an hour, sometimes a little bit more if your body needs it. Sometimes clients, part of our protocols are doing mouth work as well, and that allows us to get deeper into the cranial vault, into some things in that area, in the sinuses, all of that. And then when they're done and it's time to come back, I just bring them back gently. We debrief a little bit afterwards. They can ask me questions. Um, you know, Not that I like to get prescriptive with anything, but sometimes they're like, well, what do you recommend in the future? Or should I come back? I'm like, well, see how your body feels. If you have questions about that, let me know. So,
And is there anybody for whom craniosacral therapy would be a bad idea? Any contraindications to cranial?
so with cranial, yeah, there are a couple things to be aware of. Like anybody really that would have an issue with a change in intracranial pressure or CSF fluid. So somebody that's had a stroke, like a recent stroke or brain bleed, any kind of venous malformations, um, concussions in the acute phase, I would probably wait until like probably a few weeks after the concussion. I would want to say yes, I would see those clients, but be very careful with them because I wouldn't want to aggravate anything there. Um, Spinal taps, like any kind of recent stuff like that, you wouldn't want to have somebody coming in because that area is trying to heal. Um, Arnold Chiari malformation is also one that sort of on the fence with that. Like there's certain things that you wouldn't want to do, certain techniques on them because of the herniation um, at the base of this skull. But I would say that even them, they would benefit from cranial work as well. So yeah, just those things for the most
And
part.
and what sorts of things do people feel after treatment typically? What's common?
So after treatments, often often the response is, "Oh, I just feel so relaxed." I'm like, "That's exactly what we need because we need your body to be in that parasympathetic mode, that rest and digest mode so it can do the work of healing. Like it's a self-healing mechanism that's at work there." So very often it's I feel really relaxed or oh, my pain's better. Like sometimes right away the pain is better. Tired. So they'll just say, go home and take care of yourself, do what your body needs. If you need a nap, go take a nap, drink lots of water. You're hungry, go eat a good meal. Just listen and just keying into what that is. And um, that's like immediately after. And then I should also add the treatment's not over when I'm finished. So your body's still going to continue to unwind and do things for hours, days, sometimes even weeks afterward. You might feel shifts and changes going on, or even, those things kind of pass through your awareness, like, oh, well, that's interesting. And then it's gone. So,
That's really interesting. And no one's ever said that to me before. And it helps me to understand a little bit more what happens to me after cranial treatments, which is that
yep.
I feel very relaxed in the moment in that day.
Mm-hmm.
And the next day, I'm exhausted. I feel like a truck hit me. Not necessarily
Mm-hmm.
like a truck hit me and caused broken bones. Like I don't feel in pain, but I just feel like so depleted the next day. Is that something that is common, or am I an outlier there?
I don't think that you're an outlier. I do think that as your body's processing stuff, if it has this giant dump of stuff into your system, yeah, it can make you tired. Or it's your body just telling you, yo, you need to slow down so we can do some work here. And rather than do everything else, be quiet and rest that I can fix you. Like, so I do think that's common. And I've experienced that myself as well, where it's just, woof, I just need to be doing my thing for a few days to let this process through.
Yeah. So you're certified in both craniosacral, Ani, and also somatic emotional release, correct? What's the
So
difference there?
so craniosacral therapy is the certification for techniques. There actually is a certification for a diplomate, which is more geared towards the somato-emotional release. So that would be the next level. But somato-emotional release falls under the umbrella of craniosacral therapy. It's part of the training that we can go through. And you asked, what is the difference between the two of those things?
Yeah.
Okay, so craniosacral therapy just in itself, that would be more of like the hands-on, the very like anatomy based, what's going on in the body, what do I feel the tissues doing, what's happening, what changes have I felt, what's the client experiencing. The somato-emotional piece is using the craniosacral touch. It's the same thing. However, when you have something show up in the body that's an emotional thing, you can allow that to process either, through your hands. Sometimes a somato-emotional release can occur just by my hands communicating with the body, just through, caring intent and touch. Or that could you could go in to do dialoguing and imagery, like with whatever's going on there. If that, the client has something spontaneous come into their awareness, like, oh, it looks like a yellow blob right there. I don't know what that is. I'm like, okay, tell me more. What's going on with the yellow blob? What's it like? Does it have a texture? How big is it? How long has it been there? So it's still craniosacral touch, but you're on a specific area and you're working with that specific thing and may or may not have dialogue or imagery with that.
Got it. So it feels like there's a lot of kind of unmapped territory when you start a session. It seems like you're
Yeah.
really seeing what emerges from that person and from their body and being willing to kind of go with the flow. How do you how do people who tend to not appreciate that, like that part of their brain, do with this? Do they tend to do better, worse? Is there any kind of is there relative contraindication to very logical people who don't, first of all, even believe this is a thing, right? Or do they have great experiences too?
Um, I wouldn't say that it's a bad thing for a very logical person to try these things. How I would approach that is like, so sometimes, we have things come up in our body, like, how's your imagination? Like, do you like to play like that? Like, some people are totally open to it, and some people are like, that sucks. I don't have an imagination. I'm not creative at all. And you just kind of feel them out and see if they want to do it or not. Some people are totally resistant to it, and it's like, I'm not going to make anybody do anything. And some people are like, okay, I'll try. And then they get into it. Like they're like, oh, this is what's, and then they start noticing things and have all of these realizations that they're like, whoa, I see now. And it's, I don't know, like once they know what it's like, I think, then they're probably more likely to try it again.
Yeah.
Um, yeah, I think the only times where I would say SDR work might not be the best is if somebody is like um got some really intense like psycho emotional stuff going on where they're having a hard time being present, or if they really dissociate, or if they're in like a really big crisis mode at that time. I probably wouldn't go there unless it's like definitely part of what the body is prescribing. I would want to be really sure then that that's um, really taken into good consideration, because you wouldn't want to send somebody who has a long psych history, off into some place where they're like, they're not here and now, they're somewhere else, and it could be really scary for them or re-traumatizing. And that's not what we do. So
Yeah. Yeah. So there needs to be that consent and that awareness of what they're really kind of contracting for, it sounds like.
yeah, and as long as you're paying attention to what the body's doing and signaling, and also their language, it's pretty safe, I think. So
Do you use any of these tools with your patients in the hospice unit?
so I've had a lot of people ask me that question. I feel like sometimes with them when they're dying, I'll put my hands on them, which I guess is still considered craniosacral therapy, but I'm just more present with them. I'm not actively doing anything, trying to change anything. Because often that's what they need, is just presence and somebody to be there with them. Um, and the other side of it is I also, depending on who it is, like them to know that's what I'm doing. And many of them don't or can't speak for themselves anymore or advocate for themselves anymore, that wouldn't be able to answer a yes or no question or even understand what I'm asking. Um, so just really just that sacred presence there with them is what I try to do with them.
Beautiful. Which I think if you're not already bringing that as a hospice person, like you're probably in the wrong ward. Like everyone
Yeah.
on those wards tend to, have that in their toolbox, the ability to hold space for a sacred transition and sometimes the chaos that comes up around that for people and families in particular. Tell us, actually, I'm glad we've sort of stumbled onto the hospice thing because we have never had anyone in the Healing Grove podcast so far talk about the hospice experience. And I wonder if you have anything that you feel everyone should know about that experience, which is, you have a pretty unique window into something that most people don't see very often.
Yeah. It feels kind of like a broad question, but um, yeah, I feel like in this world where I feel like a lot of people are sort of removed from the dying process, or it's like medicalized or whatever you'd say, like, oh, they're going to go to the hospital and die, or, there's a lot of fear around it. And I think having more an awareness of what the dying process looks like might help to alleviate those fears a little bit. Um, I don't know how I would suggest that other than to read about it and, prepare yourself so like, and every death is different. Some are really easy and smooth, and some are kind of messy and a little bit traumatic. So it just sort of depends. And the best thing that you can do for anybody that's grieving, um, might be awkward to say things, but reach out to them and listen. Like just listen and be present is like the best thing that you can do if you don't know how to do anything else. Is just, I'm going to be here in this, painful situation with you, and just be here with you. And that's okay. And we're not fixing anything. And that's okay too. And it's being there while they're going through the grieving process and, learning to accept what's happened. And yeah, I don't know what else.
Well, as you're saying those things, I'm just reflecting on how many of those same traits are required for a good body worker, a good craniosacral therapist, right? Being able to be fully present, being able to listen to the person in front of you or bear witness to their story, whether it's coming out as words or, craniosacral movements or, breathing, dying. There's a lovely little book that I really loved and leaned into when I was doing my hospice rotation at Stanford. It's called Gone from My Sight. Have you seen that
Yeah,
one?
yeah, we
That's
have
a
those for patients and their
Yeah,
families.
it's a sweet little primer on how to be with dying, how to be with a
Yeah.
dying person. So for people looking to learn some of these tools and also just start to understand sort of what to expect and what, how things that look scary can be normal and okay. And just because your dying loved one seems to be laboring to breathe, it doesn't mean they're uncomfortable necessarily, um, depending on what that breathing looks like. So yeah, it's a real privilege to be able to be in that position of bearing witness to those sacred transitions. So thank you for
Yeah, I
doing
do.
that work.
I love doing it too. It's definitely it's different. It's special. It had called to me for a long time, and then I finally had the guts to do it, and I'm gonna do it till I can't. So
Amazing. Speaking of sacred transitions and the end of life, let's talk about the beginning of life. And you mentioned to me before we started that you love working with new moms and babies.
yes, yes. It's such a special thing. And Dr. John Upledger, he at some point I'd come across reading that he'd wanted a craniosacral therapist in every newborn nursery because of what happens when you're coming into the world and all sorts of things that can occur in birth trauma, squeezing those little heads coming through the birth canal, and even the implications of what a C-section is for that baby, because it's almost like the baby could get the bends coming out right away, and what that does to um, the intracranial membranes just coming out like that, and the trauma related to the birth in general, and then also the moms doing all the work. Shouldn't say all the work, they're cooperating together to come out and make this thing happen. Um, but yeah, the babies, I feel like a lot of things could be head off early, and they respond so readily to treatment. Like they are just, it happens very quickly for them compared to an adult when we, accumulate all these layers of things. The baby is just, here I am. The body knows exactly what it needs. This little inner wisdom of this baby just shines right through and, you know, responds very readily. So it's pretty cool.
I love that. What sorts of things do new moms or dads bring their babies to you for?
So I would say like treated torticollis. I've done, breastfeeding issues with trouble latching and tongue tie. Like that's a big one. Because a lot of we can do the inner oral work. Sometimes it's just working on some things inside the baby's mouth, or there's something, down in the pelvis that's actually affecting how that baby's sucking, and it's, reflecting up into the cranial area and causing tightness and jaw issues, not allowing baby to open up wide enough to get a good, strong, healthy latch. Um, yeah, so any number of things.
Cool. So um, as we finish up here, you've said a couple times you sort of described the importance of as a provider being grounded before you start, being centered. I
Mhm.
wonder if you'd be willing to share with us some of the tools that you use yourself to sort of keep your energy clear and keep your grounding.
Yes. So there was a book written by a craniosacral therapist called Full Body Presence. And that was a game changer for me, thankfully, early on when I started learning this. Because I would start to see, like, I'd get distracted by things or was so into like what I was doing and thinking, like, well, what am I experiencing? Am I doing it correctly? Like all these things. So it's a book, Full Body Presence by Susan Scurlock-Durana, and she has a second book in that vein called Reclaiming Your Body and Overcoming Traumas and all of those things. So in those books, she takes you through grounding and centering exercises, which have been extremely helpful, but even simply reading about just having the awareness of sitting down and where are you in your body right now? Are you out in front of it? Are you behind it? Are you completely in it? And you have to be in it. So most of you has to be here so that you can blend with your client and know what's yours and what's not yours. Those boundaries are like really important. And if the boundary is shifting or something is happening where you're like, oh, I'm not sure what's going on there, notice what's going on and check in with yourself after this session with the client and say, okay, what's going on with me that I need to look at right now because something was coming up in my client and affecting me in, XYZ way. So your clients are not only teaching you about themselves, they're also teaching you about you. So yeah, those grounding, centering things, also making sure I'm physically well, like I'm eating well, sleep is such a big deal. Like all those things are really important to making sure like I feel comfortable in my body and I want to be in it. Um, Spending time in nature, things that really fill up my cup, art, music, spending time with loved ones. Um, and also another useful tool is keeping your eyes open while you're working. And I've been doing that a lot more. Um, Often I would just sort of, okay, I'm in my meditative space, helps me concentrate to not focus so much on what's going on around me. What are my hands feeling? But opening up my eyes, you see a lot more about what's going on with your client and the subtle cues that might be coming from them and their body language. And B, it keeps you more present, like right here, right now. Like you're in this room, you're not elsewhere, you're not thinking about your grocery shopping or anything. Like you're right here and you're with this client. What do you need and what do they need? So,
Very cool. Lots of really actionable tips for staying in your body and staying grounded. Thank you for sharing that. Before we end, Anni, is there anything we haven't touched on about craniosacral or your path or any of the other tools that you think are really valuable for people to know about in this world that we should talk about?
I guess maybe some closing thoughts would be, wherever you are in your healing journey, just be in the moment and being okay with not fixing it, and having that curiosity and, compassion towards yourself to want to know, like, well, what do you need? So loving yourself and others in that way. And also something really cool when it comes to like trusting like your inner intuition and your knowings as well as your left brain and allowing them to work together. Really awesome teacher of mine had shared this little thing about the word imagination, which is I thought was so cool. And he broke it down that I means I, magi means magic and wisdom, the na means we, and Asian is movement. So it would mean that you and I are wisdom and magic in motion. And just to remember that and don't throw that piece away. Like you need all of it to be a more self-realized whole person and gain insight.
I love that. Thank you so much for sharing your own pearls of wisdom and the basics of a very helpful tool that I know many people want to try out. If they want to come and see you, are you taking new patients?
Absolutely, I am. And I will say, anybody that's made it this far in the podcast, I'd love to give you 20% off of your first visit to come and see me if you would like to do that. If you just mention the Healing Grove, mention Dr. Ryman, I'm happy to see you.
Thank you so much for offering that gift to my community. And thank you so much for your time and all the wonderful work you're doing in the world, Anni.
Yes, and thank you.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.